protect the mitochondria, reduce some of that glutaminergic neurotransmission with nutrients such as vitamin B6 and zinc. Interestingly, the medical and pharmaceutical approach focuses on trying to rebalance those neurotransmitters after they've been imbalanced, at least in part through dysbiosis. So rather than trying to raise and lower and block and antagonize certain receptors, we might look at what's causing that neurotransmitter imbalance and address that directly. And again, of course, towards the bottom, I mentioned a few treatments that we might use to dismantle dysbiosis, everything from diet and exercise to drugs. Now on this page, let's go through a very comprehensive list of the exact mechanisms through which the microbiome affects mental and neuropsychiatric function. So we've talked about LPS. We know that LPS promotes neuroinflammation, leaky gut, impaired cytochrome P450 detoxification, and with regard to chronic pain states, we know from animal studies that bacteria, commensal bacteria, are described as being necessary for the development of persistent pain. So obviously, when we're dealing with pain patients, we can try to reduce their total microbial load, most significant of which is in the gastrointestinal tract. We also know that peptidoglycan and other microbial molecules are certainly pro-inflammatory, perhaps working through toll-like receptor number 2, in contrast to toll-like receptor number 4, which is activated by LPS. We also have a pretty long list of microbial, metabolic, and mitochondrial toxins. These include, again, LPS, hydrogen sulfide, D-lactate, propionic acid, plus the inflammatory cytokines that are released following exposure to dysbiosis generally, but especially gastrointestinal dysbiosis. At some point in the future, we might have more evidence showing that gastrointestinal bacteria increase the endogenous production of glutamate. We do know that some commensal bacteria produce glutamate from glutamine, for example, and that can get absorbed systemically. That might be a contributor to excitotoxicity within the brain and spinal cord. Propionic acid, I mentioned briefly earlier, and I'll talk about it in more detail as we go through, causes mitochondrial and brain dysfunction, neuroinflammation. Propionic acid is noted to be elevated in patients with autism.